for very beautiful introductions, and good morning, everyone. I'm very excited to being here today as my first time in Japan and in person with APACC, and very delighted to sharing about our initiative. It's called TAP4S. We have been working with Elton John AIDS Foundation for this initiative since 2024. So TAP4S means testing for status, ART for sound health, and prevention for safe sex. And I'm very delighted to share about our models from click to clinic, and offering the flexible HIV and STI package for our community in Vietnam. So as Dan Vic has mentioned, community knows the market, we are the market, and we also the best designer of our intervention. So that's why before we designed these models and initiatives, we have been consult with a number of the community members to really collect their inputs and also design our website and also products. So the community prefer digital tool because they offer privacy, autonomy, and convenience, allowing individuals to seek information, access risk, and access services without fear of stigma and discrimination. So we took these keywords to reflect in our products, and I will introduce you later. But community also refer to discrete engagement, flexible scheduling, and also culturally relevant content and youth-friendly content as well to make the care more accessible and especially marginalized and mobile population. So I don't have to repeat about the advantages of the digital tools or like technology for the HIV care, but this is also some very profound, outstanding, I think, functions of the digital tool. It can expand the reach to hidden and also underserved population. So in Vietnam, HIV is concentrated among the key population, especially MSM and trans community. And our last report from Ministry of Health, 80% of HIV new infection in Vietnam are among the MSM community, especially people who engage in chemsex. So that's linked to a very pressing need to have the more effective intervention and creative product for the community, ensuring that they can access easily to the HIV services and information. So based on that, we work with Elton John AIDS Foundation to design the Rainbow Health Station website, and you also can access to the website by the link in Vietnamese. It's called chapsacovong.com, and our slogan is confident to love, confident to enjoy. So Rainbow Health Station was created with the aim of being trusted companion in supporting sexual health, mental well-being, and also emotional needs of those in the LGBTIQ+ community in Vietnam. So let's take a quick look into our first page of the website. We're trying to use the friendly images and also some a very appealing message for the community. So our key functions is knowledge sharing and education. We're trying to create a website where people can easily to access the comprehensive knowledge of the sexual health, of mental well-being, and also HIV and AIDS. We also design the self-assessment tools and also link them to the peer counseling function in the website. So the self-assessment tool offer them with the privacy, ensuring that they can access and also knows about the risk and also the health condition, and making sure that it can inform the decision in terms of accessing to the HIV and the other healthcare services. We also offer the user with the LGBT-friendly service map and also with the feedback collection function. So they can go to the maps, they can access the information of the healthcare facility nearby, and also they can go back and provide feedback after the using services. And free ordering of HIV prevention commodities. We offer them with the free HIV self-test kit and also free condom and lubricants, so they can order and our team will mail to their home. So that is the 4 key functions of our website. And this is a more photo to demonstrate our website and also its key function. This is the update, the news and knowledge for the community. We have the wide range of knowledge and information offering to the community, including HIV and AIDS, sexual health, but we know community need more than that. It's not only care about the HIV and AIDS, but also like mental health, self-care, about the harm reduction for chemsex community, and also like partner notification, etc. So we're trying to provide them with the comprehensive information, ensuring that they feel belong to the websites and also knows what happened with the community in Vietnam. Oops, sorry. And this is the self-assessment tool for health status and tailor support. So we offer them with 4 different tools. It's integrated in the website, and people can easily to go and very quickly, just 1 or 2 minutes, and they can access for the health condition, including substance abuse screening, using the ACEs tool. We have the mental health screening using PHQ-4. We have the HIV risk screening using our Ministry of Health form, and also the PrEP needs assessment. And after people screen for their health status, we also link them to the Rainbow Doctor for counseling after screening. And this is the Rainbow Doctor. It's just like small icon there with our helpline, but people also can chat directly with our peer counselor. We also have the AI chatbot, so people can easily to ask any question that they have, not just only about HIV and AIDS, but also like the relationship with my boyfriends, or like how I can enter to conversation with my community, etc. So we also offer them with a different platform where they can connect with their community as well, because many people, they want to like, you know, like having spaces where they can talk with the other people from the community. So we have the Telegram groups and also Zalo chat group as well. So people can easily to talk with the others and also learn from them. I think peer learning is really important, as, you know, like people can share their own experiences and also sharing about the way that they do self-care for their own health. And this is the friendly service map. So we offer the maps with more than 500 healthcare facilities in Vietnam, including public and private health facility, and also CBO network as well. So this is the map, but if you enter to the information of the health facility or services, you can see there are a number of people, so people can pick their services. That people also can pick the location where they located, and also find all information of available services in their location. And when they enter to this information, they can easily to find like what kind of services that they provide, the working hours, who is the doctors, what is the price. And after using services, they can go back and do the provide the feedback and also ranking. I think it's quite similar to like some Agodas or the other booking apps for services. And what I like in this, because like when we have the COVID-19, and people have to go back to their hometowns, and it's very easy for them to find the location nearby and near their home. They also can easily to find the direction where they can go there by bus, by train, or by their own vehicle. And this is the easy and free ordering. So we offer the HIV self-test kit and free condom and lubricant and the others harm reduction commodities. And people can easily to pick the numbers and the products, and they can insert very few information about their home address and also the contacts. And then we can mail the commodity to their home. They also can save the information for the future order. So that is the key function of this. We also on TikTok, so we're trying to bring the voices of the community and sharing the voices and stories of the community on TikToks, and got a very high number of people who view the videos and also interact with the videos. So we have the series of videos by the Rainbow Doctor, and they will answer all of the question and concern of the community, not just about the HIVs and HIV transmission infection, but we talk more about the love and how you can have the pleasure while having sex, using drugs, in safe sex, and also like self-care as well. So we do have a lot of wide range and very diverse topics for our video TikTok. This is a lucky wheel. This function added after our conversation, after 6 months with our user, and they said that, I feel like the website a little bit boring because like there are no interactions and there are no like games, etc. So we're trying to add the lucky wheel so people can do the wheel. They have to answer a few questions and insert their information, and then they can get some like prize here. As you can see, the tote badge, also the raincoat. As a Vietnamese, we have a lot of motorbike. So when raining, we need the raincoat. We have a lot of stickers there, very colorful, and people can use for the pride events, etc. So this is the whole functions of our website. We also trying to bring community from online to real life. So we organize some community events and meetings. So we have the meet and greet offline event for LGBTIQ youth who are also the website user. We have the large number, very beautiful and very vibrant community in Vietnam. So we do games. We do a lot of like interaction games during the event, so people can also learn about the HIV and AIDS, but also can interact with the other people from their community. So also in our effort to bring community from online to the clinic, this is the procedure from online to offline. So we do a lot of reach and outreach from online platform, from the community events, from the hotspot, and then we bring them to the clinic to do like screening for like more deaf screening tool. For example, like for mental health, we also screen people with the PHQ-9 or GAT7. And afterwards, we offer them with tailored support with HIV services, but also people who engage in chemsex with harm reductions, including the brief intervention recovery groups and chemsex plan. And we also refer them to other services nearby by like STI and mental health addiction treatment, and also continue support the community and our clients being their friend. And this is the Lighthouse Community Clinic. We are trying to offer the PLHIV and also friendly services at our clinic here. It's just a few photos, but we also offer a number of the services at our clinic, including the chemsex and HIV counseling and testing, also mental health screening and support, and also sexual and gender-based violence care package. So we're trying to use a person-centered approach from the community to community, and we realize that PLS really has its own power. So it can help the community. They can easily to share their own stories. So that is a really advantage of the PLS services. This is some result from our website. We start from, I think, March of 2024. Until now, we have more than 25,000 web visits. We have more than nearly 1 million TikTok video views, and also more than 10,000 Facebook follows. And in terms of the services, from January to December 2024, we deliver the HIV self-test kit for more than 2,000 people. We also offer HIV testing for more than nearly 5,000 people in Hanoi, in Ho Chi Minh City, and also Bình Dương, so 3 provinces of the project. And we also support for more than 1,500 people to initiated on PrEP, and also more than 300 people initiated on ART treatment. So that is a key result from our models. And this is some key lesson learned from our side. Co-design with the community is really essential. As I already explained it, it's really important to engage community from the beginning of the design, the products, and also deliver the products, and also monitor the effectiveness and also the outcomes of the intervention. Trust must be built before linkage happens. We have to spend a lot of efforts in terms of building relationship with the community. We don't trying to bring them from online to offline immediately, but trying to build relationship with community before that. Tech simplicity and also accessibility win over complexity. We're trying to, I think a few years ago, we also have one app on smartphone, but it's not work very well. So we think that the website is seem like very easy to sustain and also offer community with a lot of function. So just trying to provide a very simple way that people can use and access to the information and services. And peer support behind the screen matters. We have the number of peer educators help us to do counseling and also support community to access the services. And lastly, listen to the user and adapting along the way. We try to also adapt our website with the languages, with the photos, with the images, and also function to making sure that this can meet the needs of the community and they feel belong to when they access to the website. And this is some next steps, what we're going to do with our website. Finalize referral, booking, and reminder system integration. We received this input from the community that they need to have the platform where they can easily to book the appointment to the clinic, and the clinic also can easily to manage that. So we're trying to finalize this function later of the year. Optimize mobile access and data light use. We're trying to making sure, because people use phone more than laptops, so making sure that it's, like mobile access is really important. And lastly, advocate for digital health integration into the national strategy. In Vietnam, we have a chance because we are now reviewing the national strategies. And this is time for us to really advocate and also integrate the digital health innovation into our health system. And this is the last slide, and thank you very much for your listening. If you have any questions or you want to connect later, please email me by the email there. Thank you so much for your listening.